Millions of New Yorkers at risk of losing health insurance. New Yorkers face health insurance crisis, millions at risk of losing coverage. Imagine waking up one day to find out your health insurance is gone. That's the grim reality for millions of New Yorkers today. In a recent warning, Governor Kathy Hochul announced that New Yorkers are on the brink of losing their health insurance, as the fallout from President Donald Trump's One Big Beautiful Bill Act begins to unfold. This legislation, signed on the 4th of July, promises to cut $3 billion from New York's health care system, potentially leaving over 2 million residents without their current coverage. Among those affected, an estimated 1.3 million could lose access to Medicaid due to new eligibility rules and verification processes. Controversial provision teaser but here's where it gets controversial. The One Big Beautiful Bill Act, which Trump signed into law, has stirred up a hornet's nest of controversy, especially concerning its impact on Medicaid. New York, with one of the largest Medicaid programs in the country, is particularly vulnerable to the bill's sweeping changes. Clarifying complex ideas to help beginners understand, Medicaid is a joint federal-state program that provides health coverage to low-income individuals and families. The new law imposes stricter eligibility criteria and verification hurdles, making it harder for many New Yorkers to qualify. The nonpartisan Congressional Budget Office estimates that this bill will cut about $1.1 trillion in health care spending over the next decade, resulting in 11.8 million people losing their Medicaid coverage nationwide. Highlighting a controversial interpretation. One of the most contentious elements of the federal law is the restriction on immigrant populations eligible for Medicaid coverage under the Essential Plan. Only green card holders and immigrants from a limited list of countries, including Cuba, Haiti, and some Pacific Island nations, will remain eligible. This change could strip coverage from about 500,000 immigrants in New York alone. Emphasizing the impact. The governor warned that this change would leave the state with an estimated $3 billion annual bill if it opts to maintain their insurance. Hochul is evaluating potential legislative responses, given a 2001 state court ruling that requires the state to provide Medicaid coverage to some immigrants excluded from federal programs. We're having discussions now internally, but also will be engaging the leaders of the legislature during this time, she said. Rural hospitals at risk. Hochul also warned that the federal healthcare cuts would hit rural hospitals especially hard. Most of our state is rural, she said. If we start closing these hospitals, you'll have to drive great distances, and that's dangerous. Additional funding changes. The Supplemental Nutrition Assistance Program, SNAP, is also set to undergo funding changes. Under the new law, states with a payment error rate of 6% or higher will have to share some of the cost, beginning in 2028. New York would be required to fund 15% of all SNAP benefits starting in October 2027, a projected $1.2 billion annual cost. At the same time, the federal government's share would drop from 50% to 25%. What people are saying. New York Governor Kathy Hochul said in a news release, while Republicans in Washington callously slash funding for vital programs across the country, my administration is standing up for New Yorkers to soften the blow of these cuts amidst an affordability crisis. President Trump's devastating, big ugly bill will inflict harm across the state, leaving detrimental gaps in funding and families without the crucial benefits and coverage that they need. New York State remains laser-focused on ensuring New Yorkers have access to resources and support necessary to uplift them and their families. Thought-provoking question. What do you think about these changes to healthcare and nutrition assistance? Are they necessary, or are they putting vulnerable populations at risk? Share your thoughts in the comments below. Republicans destroy New York, the big ugly bill exposed. Imagine the shockwaves rippling through New York State as Governor Kathy Hochul convenes an urgent cabinet meeting to tackle the devastating impacts of what's been dubbed the Big Ugly Bill by President Trump. This federal legislation, pushed through by Republicans, is set to inflict severe cuts on New York's healthcare and nutrition assistance programs. The stakes are high. We're talking about a potential $13 billion cut to New York's healthcare system, 1.5 million New Yorkers losing their health insurance, and over 300,000 households facing the loss of some or all of their SNAP benefits. Governor Hochul is not taking these threats lightly. She has directed state agencies to develop comprehensive strategies to mitigate the long-term damage to these vital programs. But here's where it gets controversial. While Republicans in Washington are making these drastic cuts, Governor Hochul's administration is standing firm, determined to protect New Yorkers from the fallout. While Republicans in Washington callously slash funding for vital programs across the country, my administration is standing up for New Yorkers to soften the blow of these cuts amidst an affordability crisis, Governor Hochul declared. The Big Ugly Bill is poised to leave significant gaps in funding and strip families of crucial benefits and coverage. New York State is resolute in ensuring that its residents have access to the resources and support they need to thrive. And this is the part most people miss: the impact of these cuts goes far beyond just the numbers. It affects real people, real families, and real communities. The healthcare cuts alone are staggering. More than 2 million New Yorkers could lose their current insurance coverage. This includes approximately 730,000 lawfully present non-citizens who could lose Essential Plan, EP, coverage, as more than half of EP's budget, $7.5 billion in federal funding, is eliminated. Additionally, 1.3 million New Yorkers will lose Medicaid coverage due to new eligibility and verification hurdles. The ripple effects are immense. Uncompensated care costs to hospitals and providers are estimated to rise to more than $3 billion annually. This means less access to care and higher medical bills for New Yorkers. Analysis from the Greater New York Hospital Association, GNYHA, and the Healthcare Association of New York State, HANYS, estimates a total $8 billion in annual cuts to New York's hospitals and health systems. This could force hospitals to curtail critically needed services such as maternity care and psychiatric treatment, not to mention downsize operations, and even close entirely. These consequences will not only affect Medicaid enrollees but also harm everyone who requires hospital care, leading to longer wait times and less access to critical services. But the impact doesn't stop at healthcare. The SNAP program, which has historically been fully funded by the federal government, is now facing unprecedented changes. For the first time, states will be required to contribute to the cost of benefits or risk ending their SNAP programs entirely. This jeopardizes a program that nearly 3 million New Yorkers rely on to put food on the table. New York State will be required to fund 15% of all SNAP benefits starting as early as October 1, 2027, at an estimated cost to the state of $1.2 billion per year. The law further cuts the federal share of SNAP administrative costs from 50% to 25%, increasing costs for the state by roughly $36 million annually, and for counties and New York City by roughly $168 million annually. Counties will have to begin incorporating this fiscal hit into their 2026 budgets due this fall. New York State is also facing more than $900 million in lost SNAP benefits for New Yorkers due to new, more punitive program requirements that will make it harder for people to qualify for the assistance they need. The law imposes unnecessarily administratively complex work requirements on SNAP recipients, which is projected to result in more than 300,000 households losing some or all of their SNAP benefits. With an average loss of $220 per household per month, New Yorkers are projected to lose more than $800 million of SNAP benefits due to these changes. The law further restricts eligibility for legally present non-citizens who have previously been eligible for SNAP, now excluding anyone that does not have legal permanent resident status, Cuban Haitian status, or Compact of Free Association status. As a result, 41,000 non-citizens in New York State, including individuals granted refugee or asylee status by the federal government, are expected to lose the food assistance they rely on to feed themselves and their families, totaling roughly $108 million in lost SNAP benefits for New Yorkers. The law also cuts funds for the SNAP-Ed New York program, which promotes healthy eating and efficient use of already modest SNAP benefits by teaching SNAP beneficiaries how to shop for and cook wholesome, healthy meals on a limited budget. As a result, New York will lose $29 million annually that funded this work by 18 community-based organizations throughout the entire state, including Cornell Cooperative Extensions in Albany, Allegheny, Erie, Wayne, Oneida, Onondaga, Orange, St. Lawrence, Steuben, and Suffolk counties. Beyond worsening food insecurity and malnutrition, cuts to the program will hurt local businesses and weaken SNAP's ability to boost local economies in every state. The U.S. Department of Agriculture's, USDA, own research has shown that SNAP benefits have a multiplier effect, with every $1 spent on SNAP generating $1.54 in economic activity as recipients spend their benefits at local businesses in their communities. For New York, where a total of approximately $7.4 billion in SNAP benefits are issued every year, that means $11.5 billion in economic activity is generated annually across urban, suburban, and rural areas alike. New York's unaffordable and unprepared budget, a fiscal watchdog's warning. New York is on the brink of a financial cliff, and most people don't even realize it. That's the warning coming from one of the state's leading fiscal watchdogs, who claims both city and state budgets are dangerously bloated and leave NYC vulnerable to economic shocks or federal funding cuts. So, how did spending spiral out of control, and are leaders really willing to make the tough choices to fix it? Let's break it down. The Citizen Budget Commission, CBC, an independent group dedicated to making sense of public finances, recently sounded the alarm about what it calls unaffordable and unprepared budgets at both the city and state level. They specifically flagged Governor Kathy Hochul's $2 billion inflation relief program, a high-profile initiative tacked onto New York State's record-breaking $254 billion proposed spending plan for the coming year. Programs like those sound great, but can the state even afford them if a recession hits or Washington, D.C. slashes aid, critics argue. But here's where it gets controversial. The CBC also took direct aim at a cornerstone of Democratic mayoral candidate Zohran Mamdani's platform, a proposal to increase taxes on New York's wealthiest residents and big businesses, all in hopes of funding more than $10 billion in ambitious new programs. The plan has strong supporters who say the rich should pay more, but detractors, including the CBC, maintain that higher taxes will only drive high earners, and their tax dollars, away. Anna Champany, vice president of research at the commission, put it bluntly, we can't keep raiding our emergency savings, and now is not the time to raise taxes further. According to the CBC's analysis, both the state's huge $254 billion budget and the city's own nearly $116 billion spending proposal fail to set aside enough reserves for rainy days, even though they are packed with costly public benefits and freebies. Their calculations show the next NYC mayor will inherit a budget hole between $6 and $8 billion just 2 weeks after taking office, the result of overly optimistic projections and political promises, plus the looming cost of a new law shrinking class sizes in public schools. Meanwhile, the state government is also staring down an almost $22 billion gap between ongoing revenues and spending. And this gap could grow if the federal government follows through on threatened cuts. Patrick Oriki, CBC's state policy director, summed it up, the big takeaway from this year's state budget is simple, we're spending way too much and saving far too little to deal with what's ahead. Yet, Governor Hochul insists she's acting responsibly. In a recent interview following a cabinet meeting, she defended her decision to reduce the size of the state's inflation rebate program, trimming it from $3 billion to $2 billion, just in case more challenges arise from shrinking federal aid. The governor, who's up for re-election soon, has repeatedly rejected calls to raise income taxes, especially those endorsed by Mamdani, but whether this resistance will last remains an open question. Interestingly, the governor's own budget chief, Blake Washington, didn't entirely rule out future tax hikes. When questioned by reporters last week, he commented, here's the real dilemma, do you raise taxes because you want to invest in bold new projects, or just to cover past mistakes? Until we get all the facts, we have to keep our options open. Hochul's spokesperson Kristen DeVoe defended the governor's approach, reiterating that this year's budget focuses on making New York safer and more affordable. She emphasized that the legislation includes provisions giving the governor flexibility to make mid-year adjustments if the fiscal picture unexpectedly worsens. Mamdani's campaign, however, had no comment on these criticisms or the CBC's pointed questions. And this is the part most people miss, is New York sliding into a pattern of taxing, spending, and hoping for the best instead of preparing for the worst. Here's a question that could split this city right down the middle. Should New York hike taxes on the wealthy to expand social programs, or are we already spending beyond our means? What's your take? Is fiscal discipline more important than bold new benefits? Share your thoughts in the comments below and let's debate what the real priorities should be for New York's future.